Hi, I'm Dr. Jennifer Scherbauer, a naturopathic physician, chiropractor, and acupuncturist here in Edgewater, Chicago. I have a practice on Sheridan Road at basically the corner of Foster, and we see a bunch of different type of patients here with a slew of different psychosomatic disorders, holistic approaches to how to take care of that. And one of the practitioners that I work very closely with is Shira B. Hall. And I'm going to pass it on to Shira to explain what she does and who she is and some of her qualifications so you guys can get to know her a little bit better.
Thanks, Jen. Hi, I'm Shira. I'm a licensed clinical professional counselor, an LCPC, and also an art therapist. I also have a background myself through my own experience. I'm autistic and I have ADHD and I have a history of PTSD. So all of that I bring into my work currently with my clients. It's kind of a new field with some of the redefining of what autism looks like these days, so we'll talk about that a little bit. But finding a good practitioner that is really familiar with these things is really important, and also the work that I've been able to do in concert with Dr. Jen with some of the physical stuff that comes along with autism has been really, really cool. So I'm excited to be here and talk to you guys today.
Yeah, and just to go along with that, things like autism and other neurodivergent disorders or struggles that people deal with, it's a holistic problem, or a holistic issue where people aren't just, they may be DSM defined or diagnosed with a label, but it presents everywhere in the body. So we're talking about, it's not just a mental thing, it's a physical thing, it's an internal medical thing. There are many comorbidities. It's almost algorithmic, but also kind of expansive for each individual. So we work really, really intimately together on each person to provide absolutely individualized care along the entire journey of their, getting them to a place where they are well and functional. So what I wanted to talk about is kind of that, you mentioned the spectrum of autism, and we've heard that, but it's being redefined, as you said, and we're seeing kind of people that we normally wouldn't have tagged as that, not quite as obvious, but still struggling. Yes. So still struggling, and they have their own, concerns, and these manifestations that we were talking about. So I kind of wanted to open that, up to you to educate us a little bit on like what this new spectrum or range is that we can kind of keep in mind, when approaching people, or just, if you might think you might have it and where to go and what to do about it, just what to look for.
Okay. Yeah, so traditionally when people hear the word autism, they're almost immediately thinking one far side of the spectrum where maybe people can't speak or they engage in really obvious physical behaviors, or maybe toe walking. They're looking at that lower level of functioning, and just like a lot of psychological issues, it's much more of a range. So for me, for example, on the surface, I like to think I appear as quite a functional human being. But you're hearing me speak quite fluidly right now. But when things do get really overwhelming, or I have some of those autistic issues come up, there are times when I can't. So, but other people in my life wouldn't necessarily see that. So that is sort of something to be aware of with the opposite side of the spectrum, is there's the appearance of a high level of function. We kind of divide it into 3 levels when we diagnose, and those are based on how much assistance a person needs in their life. So I would be a level 1, very little assistance, but there are definitely still areas of functioning in life that are sort of invisibly difficult. One of those is this connection, the work that we do holistically with Dr. Jen, which is autism often comes along with a lot of physical aspects. It's basically characterized by a really intense ability to sense things. Your senses are really heightened, right? So imagine being able to feel every fiber of every muscle, not just a big muscle group, but every moment of every day, you can feel every tiny little movement that your internal body is making. That's a lot. And in addition, there are some, I'll pass this back to Dr. Jen in a bit, but there are some things that often show up with autism, like hypermobility, which makes it very difficult. Like there's a lack of collagen in the joints, so it makes it difficult to hold still. So you get that kind of like constantly feeling like you can't hold still. A lot of micro things. So when we work on it in therapy, we're usually talking about strategies to A, deal with a higher level of distress that just exists, and B, strategies to sort of manage that hyper awareness of things, so that you prevent higher levels of stress from or distress from occurring in the first place. If you're thinking that you might yourself be autistic, you definitely want to see a professional. Don't try to self-diagnose on the internet, obviously. But if you're looking for just a brief screener, there's a website called embraceautism.org. And that, usually, if you're going to just do one thing, I'd try the RADS-R. That'll give you sort of like a cursory thing. It's one of the tests that are used in evaluation. Again, it is not a diagnosis by itself. This absolutely needs to be verified by a professional because there's such a huge overlap between things that an autistic person experiences and a person with ADHD and a person with anxiety. You really need a professional ear to do the interview, to do the rest of the testing, to sort of figure out exactly what's going on in your picture, but it's a place to start. It's a little information you can bring into an appointment.
And they can help like tier you correctly and guide you to the right other professionals that'll be supportive help, right?
Exactly.
Are you one of those people that you would bring the test results to if the RADS-R comes back, saying something either minor or significant as far as like involvement with the autism at all?
Yeah, that's a great question actually. There is a lot of confusion out there about who can diagnose autism, and here's why. So there are some practitioners like myself, a licensed clinical professional counselor. I can give a diagnosis of autism for the purpose of insurance, for the purpose of work and school accommodations and things on that level. If someone needs a diagnosis for the purpose of Social Security or sometimes for Medicaid and things on that level, then the system requires someone with an MD. So what you can do if you're looking for a diagnosis for yourself, if you're looking for therapy to come up with strategies to help you as a neurodivergent person cope in a neurotypical world, then I would say your move is to go to a therapist and look for that diagnosis, bring in that scan, be like, hey, I think this is what's going on for me, what do you think? Because you're looking at helping your function. If you're looking for one of those other purposes like Social Security, then you do need to maybe take that resource into someone with an MD.
Like a psychiatrist or something?
Yeah, that's a good point. Like a psychiatrist. Your general practitioner, like your primary care doctor, can at least give you a starting place, but a psychiatrist is going to be more geared towards it.
Would it be fair to say that someone could come to a LPC?
LCPC.
Yes, LCPC.
Yeah.
If they
It's a
can,
mouthful.
I know, mine aren't that hard. It's 2 letters. But it would be fair to say that like they could bring, because I feel like accessibility might be easier with someone like you. If they could bring it into you, and then you could help triage that to the correct individual. The professional.
Absolutely.
Okay.
Absolutely.
Great.
I also personally work entirely online. There are some practitioners who do a combo, but I do find that the online medium tends to be a little easier for us neurodivergent folks. There's less to manage in terms of masking, which, if you haven't heard the term masking before, is this very adaptive skill that neurodivergent people learn as they grow up in order to create facial expressions and body language based on what they think they're supposed to do and patterns that they've learned to recognize. So it's not an automatic thing for autistic people. Like, for a neurotypical person, something happens, they react. Emotions are very connected to actions, right?
Yeah.
For an autistic person, there's kind of more of a separation between perception, intellectual processing, and emotional reaction. So someone may have learned masking as that skill to like seem normal, right? But that can take a lot of energy. We call it spoons. You can look up spoon theory. That's another fascinating thing. Not for this video, but
That would be a good other video though.
yeah, right. Spoon theory is great. But yeah, it takes a lot of energy for a neurodivergent person, especially one with autism, to be in a room with someone. They might be constantly monitoring the other person's body language, their own body language. It's a lot.
And I have to say, just being in a new environment is, I've noticed, it has to be very comfortable. You know, it has to be, not that this place, my office, by no means is comfortable, it looks like a torture den, but the energy has to be comfortable, number one. It does take a little bit more time to like break that, I think. So keeping, when you're focusing in therapy, at least with my therapeutic experience with my therapist, being in the comfort of my own home allows me to not have to, you know, also be worried about or distracted by posters and, you know, sharp objects, you know what I mean, things like that. So,
and we can have our fidgets.
Exactly.
I crochet during every session. I encourage clients to wear their pajamas. It's great.
Yeah, and so you mentioned a couple things. I wanted to kind of circle back just mildly. You mentioned a couple things about different psychological comorbidities that you might have. So you were talking about like ADHD, you were talking about anxiety, where they can actually be an overlap and not a comorbidity. And by the way, a comorbidity is when you have two concurrent disorders, diseases, syndromes, whatever at the same time. And a lot of different diseases go hand in hand with that. So I'm very much familiar with the physical, right, and the presentations, and we'll go over that. But the psychological, that's not really my realm. So I was wondering if, you know, you could touch light upon that, because I've heard, you know, just from patients and, you know, friends and family, that sometimes they're in therapy for a thing, like say anxiety, but it's just not getting there, and there's just more to it, and it feels like there's like a ceiling or a block because there's a little bit more, and it's like, then sometimes there's a epiphany moment where they're like, oh, actually you have concurrent ADD, like your anxiety is actually caused by ADD or something like that. And then that kind of fits the pieces a little bit better. But like with autism, I was just wondering if there's other things that somebody might be going to therapy for, a psychiatrist, and maybe kind of like, oh, we're just not quite hitting it. Like there's just more. It's just we need to get a little deeper, or we're hitting on the surface of these things, and we're going in a gerbil wheel, and we're not quite getting enough, you know? So or if somebody's walking in and they have multiple things, they already have ADD and anxiety, for example, because we're just going to use what you were speaking on. But again, they're like, okay, the but comes, you know, where I need more, and maybe they go in, that would spur them to go take this test, because they're like, actually I do have all of those, so like maybe we can kind of sum this up, or at least build a foundation that will be even more supportive if I can get that.
Yeah. So what I'm hearing you ask about is two things, alternative diagnosis or additional diagnosis, and alternative treatment methods than maybe what they've experienced in traditional psychotherapy or CBT, cognitive behavioral therapy. So yeah, there's such an interrelationship. For example, if someone has ADHD, it may create anxiety because they're constantly losing their stuff and forgetting things. Right. If someone has autism, same thing, it can create anxiety and depression because you don't know that everyone else isn't experiencing the same thing. You think you just suck at life.
Right? Well, and you're constantly overwhelmed, right? Because
Yeah,
like that's the one thing
exactly.
I've noticed. It's just, I mean, if you're feeling every muscle fiber in your body, and you're having to feign facial expressions or body language in order to fit in with what you see other people doing. That is, you said energy expenditure, but there is also, it's just like mentally overwhelming to have to keep track of all that and to try and put that forward.
Think about a simple task like doing the dishes, right?
Yeah.
For somebody else, that's one step. For a neurodivergent, that's 6 steps, and they're all really sensory intense.
Yeah, that's huge.
Yeah. So when someone is going to therapy and they're just like, oh, I'm hitting this wall, there's something else, right? Usually the clients I see have been in therapy before and they haven't, they're in that situation. And they'll tell me, oh man, I've never had therapy like this. I've never had it work for me like this before. So one thing that we do want to do is that alternative diagnosis. Run through like, hey, what else could be behind this? Is there neurodivergence? And the second thing is that once we understand what that full picture is, then we want to make sure that the treatment we're using incorporates not just a relationship between thoughts and behaviors, but also thoughts, behaviors, emotions, and the body. So, like I mentioned earlier, that connection between intellect and emotions is a little bit trickier for neurodivergent folks. There are skills that we can specifically learn that help strengthen that relationship. The brain literally changes from things like dialectical behavioral therapy, mindfulness and meditation, which I've told you before, I actually first encountered when I studied Kung Fu. But think about it, like if that type of meditation is meant to help you deal with fists coming at your face and still maintaining your grounding and awareness. Hopefully you don't have literal fists coming at your face, but we have metaphorical ones, right? All that overwhelm.
Exactly.
So mindfulness, we talked a little bit about that mind-body connection in terms of when dealing with trauma or other forms of neurodivergence, specific body motions that help release that or help maintain grounding and calm. The occurrence of PTSD in people with autism is so much higher than the general population.
That's crazy to think, you know what I mean? Like,
so like all of this is so interrelated, and it's important to get a treatment method that is addressing all of what you're dealing with. So just to review, intellect, emotions, and the body, and the behaviors. How to do it all.
Yeah, and then how to figure out how to make that happen in a neurotypical world, right? Like then you send them out to the world.
Oh, that is my jam right there.
I know.
Yeah.
It's like that's great at home, and you can do all the breathing, the fidgets, and weighted blankets, which we'll talk about later. You can do all of that, and the DBTs and everything. But then when they leave their house and they go grocery shopping or whatever the deal is, go for a walk on the beach, that they also have to deal with those fists, you know. So fists are coming, I think, sounds like from the inside and the outside a little bit. So mostly from the outside, but when you magnify your kind of stepping out of your small environment into the world, it's a lot more. We live in Chicago. I mean, like I get distracted just driving to work, by signs and sounds and terrible drivers and everything like that. So, but I kind of want to talk a little bit more about, the body, and the reason is because, I'm sure you've mentioned that quite a few times, but that's the perspective I see most commonly, right? And that I have the most familiarity with, and that is why I think it is amazing that we were able to connect and integrate so, intimately for our patients. But what I'll talk about a little bit of what I see within the office. Here, you know, we were talking about how patients will present with some physical symptoms, right? The most common, Shira mentioned, hypermobility, number one. Like, and hypermobility means that your tendons and ligaments and your, what should be very secure collagenous structures in your body actually are kind of like rubber bands, you know? So, whereas a person, and I'll use this as a pretty easy comparison, a person, you know, who does not have hypermobility, they can bend their finger about here, and a person who has it, can't, will go all the way back. Yes, like that. Elbow test, you know, if you don't keep a straight line with your elbow and you have an inverse, you know, pyramid shape or upside down triangle or upside down V, yeah, that is another sign of it. But it goes for a lot of the joints, and that these are not even weight bearing joints. So over time, and a lot of the time by the time somebody realizes and has been diagnosed on these tier 1 or these higher functioning levels of autism, or any neurodivergent disorder, they are usually within their 20s, and they've struggled for a hot minute, and they've tried all the things, right? But then they come in here, and we're dealing with things like occipital headaches, you know, migraines that start from here and go around, joint problems, hip, knee, ankle, structural issues that come with that, because also muscles are created with collagen, so it's separate type, but you know, muscle weakness, you know, so that doesn't lend towards stability at all. And when you are sensing every single muscle in your body and every fiber at all times, and you're unstable, like, can you imagine? That'd be like walking on a surfboard or a waterbed your whole life, you know what I mean? Like,
That's accurate.
It's a lot, right? You know? So, but also things that can happen so easily, where, you know, you're walking and you step off of a curb and your ankle hits the ground in the wrong way, you know? So I see a lot of that, and that's just hypermobility. There's also, from the naturopathic point of view, there's a lot of gut issues, you know, a ton, whether it's IBS, whether it's, you know,
there's such a relationship between the emotions and the gut.
Oh yeah, and the gut-brain axis, that's going to be a whole talk,
yeah.
Whole series that I end up doing. But it's, and you know, vagal nerve issues, where there's like rib flare from, you know, collagenous issues, but also from loss of tone of the vagal nerve and the phrenic nerve, which control the diaphragm. And the diaphragm
also is keyed into anxiety
and heart rate and everything. So there's so many different things, you know, even things swallowing. Patients have issues swallowing because of the vagus nerve. Some different, you know, branches off of the vagus nerve for that. But in the presentations, we were talking about mind-body connection. So for example, if you have vagal nerve dysfunction or loss of tone, you have diaphragmatic issues, cardiac, for example, that would result in like high heart rate or very low heart rate. And that could either be, low heart rate could present as, somebody could look at that and be like, oh, you're chronically fatigued, which is a really weird blanket diagnosis, but that's another story. And then, or they could see rib flare and be like, oh, we've got to work on your core strength. And that's fine and all, but if your anxiety is caused by a vagal tone issue and you're giving someone a beta blocker, or your rib flare and your anxiety are caused by diaphragmatic issues, you could have a 6-pack and that's really not going to matter, you know what I mean? So, but that being said, there's a ton of different interplays within the body. There's also the sensory part of feeling overwhelmed, and you're sensing things like how your food tastes and how food feels in your stomach and how it feels in your gut. And you know, if you also have these gastrointestinal issues, like, it's just compounding everything. So,
and when you try to manage diet, for example, there's sensory issues.
Yes, yeah, absolutely. So there's a lot of other physical things that we've noted here in practice. A lot of them has been a learning curve, and Shiro's helped me immensely. And that's kind of why we're doing this. It's not only for the public, but it's also for any practitioners who have seen some neurodivergent or spectrum patients come across, into their office, and they're kind of at a loss of what to do, just some tips and tricks. But little things like light pressure drives them crazy, right? Like,
Yeah.
It really drives people crazy. It's like a tickle, but it's times 10, and it feels like electric wires are going off in your body. It's not comfortable.
It's like getting that shock down your spine.
Yes, and most people can handle that, but they need firm pressure, right?
Mm-hmm.
And then there's other things like the joint pain that they feel is so much more for like the same thing. For example, if somebody has their sacroiliac joint, which is kind of like this bikini joint underneath your glutes in the back of your spine, it's kind of like the shelf for the rest of your spine, where it hits and meets your pelvic wings. In gait, because of the hypermobility, that can come out a lot, and I'll use that term lightly, but in treating it, the pain that you feel from an adjustment, or the pain you feel from a tool hitting it, or a pain you feel from a needle, like you feel it more. And so
I do want to mention that one of the hallmarks of autism and sensory issues is that sometimes they're hyper, but sometimes they're hypo.
Okay.
Like, sometimes you will actually, on one day, you won't be very aware.
Okay.
You can actually take really high levels of pain and not realize.
Oh, that's
So,
dangerous.
Yeah.
Okay.
And it's sort of like, so that inconsistency is an important thing to mention, because it's like an extension of when anybody has factors going on in their life, right?
Mm-hmm.
Like maybe one day is really not stressful and another day is really stressful.
Yeah.
Those changes all have impacts on how you are physically experiencing things.
Okay.
Right.
And that's fair. And so to check in, basically.
Yeah.
If
So
it
to
is
check
kind of
in,
a vastly day to
you
day.
can't assume that things are going to be the same as they were the last appointment.
That's actually a really good thing. I think I personally would do that here just automatically. Or, I mean, I'm lucky because, Shiro's kind of coached our mutual patients to come in and like tell me as they walk in the door, like, today I'm feeling this, and today I'm not going to do well with that, and today I'm having this. And it's like, I mean, I kind of have an alley-oop. I'm lucky for that. But, if you don't have someone like Shiro in your corner who's coaching them in that direction, definitely check in with your patient. It's not, sometimes I see medicine going into this kind of conveyor belt system where everyone's just kind of like, go do this, like this is a protocol. That's not going to work.
Yeah,
with this demographic.
I'm right on board with you. I think probably the most important thing to do for your neurodivergent clients is empower them to communicate. Let them know, hey, you have something going on that I'm not in your head about. I know I'm the doctor and in this expert authority position, but you are the authority on your body.
Yeah.
Please tell me what you're experiencing, and if there's something you need to make this appointment easier, let us know. For example, like when I first came in here a couple years ago, like at first, there were a lot of things that made it really hard for me to be here. There were like bright lights. One of the machines was holding my head in a way that was too intense.
There's one that sounds like a gun.
Yeah. And I'm super motivated to like improve and do these exercises and get better, but then like there was an appointment where I was in tears, feeling so stressed out about coming in. And I finally did, and I was able to talk to you and talk about what these things were. And that's sort of where this whole relationship started, was figuring out what makes an office more neurodivergent friendly.
Yeah, and for practitioners, I highly recommend having a sensory deprivation room or space where you can take patients and they just get to chill out, and they do not have the burden of the different sounds and noises and lights, that has been extremely helpful.
Also, if you don't have the option for a separate room, because not every office does, options for levels of lighting, or even having a washcloth over
Yeah.
the eyes.
Yeah.
Encouraging them to bring their own earplugs, or even having some earplugs can be helpful. Having some fidgets.
Yeah,
Like
that-
you can see, I've been using this the whole video because it just sort of, it takes part of the brain and lets that brain exist there, so the part of the brain that is speaking right now is free to do their thing.
Yeah, and they're not like talking to each other, you know. But the just different things too, you know. I would highly suggest for practitioners, and if you're a patient, you walk into a doctor's office and they don't offer this on their intake, having a separate section that has different issues, like other issues where it's just a checkbox, and including, you know, neurodivergency, maybe with some like subcategories of like autism spectrum, ADHD, different things like that.
And some options like, am I light sensitive,
Yes.
sound sensitive? For PTSD, an important one is always tell a person what you're going to do before you do it.
Yes.
And allow them to be facing the door whenever possible. And just, if you are the patient coming in, this kind of goes into the summary of the entire treatment approach for neurodivergence, which you alluded to earlier. That it's a neurotypical world out there. It's structured for neurotypicals. It's not bad to be neurodivergent. In fact, there are a lot of things, frankly, we're better at. But there are also a lot of these things that we really struggle with. So we have to figure out how to make that neurotypical world adapt a little bit for us to really function well and shine in our abilities. So neither one is better or worse. It's not better to be neurotypical. It's not better to be neurodivergent. They're just different. And when you walk into a doctor's office, there's kind of like a co-responsibility for the doctor to ask what's different about you, and for you to tell the doctor what's different about you.
Exactly, and if a doctor does not have that on their intake paperwork, I would highly suggest you come prepared to advocate for yourself. I mean, that's a really good way to tell how trained, how much experience somebody has with this demographic, and if it doesn't, at least at the forefront, look like that is the case, does not mean that a doctor does not have that. It may just mean that that's just not the structure of their practice, however that was, you know, created. You really do have a responsibility as the person who lives in that body to advocate for yourself if those options are not made available to you at the office. So that is something that has helped my patient or our patients. It's helped me when I go into different doctor's office. I'm like, oh wow, they're missing this whole chunk. So I'll just write it in, you know, and that's not overwhelming, and it answers a lot of questions up front, and it preps the doctor to know what to do, especially if they do get training eventually, or they do have the accommodations available. They'll know exactly, like, okay, shunt that person. We're not gonna put that person next to that noise machine. We're gonna dim the lights, put on, you know, use natural light or whatever we can, you know. Ask the right questions.
And I will
things
tell
like
you,
that.
as someone obviously neurodivergent, one of the things we experience a lot is a lot of invalidation of our experience. And it has been such a validating experience to be in this office and be able to say, hey, this is a little hard, can we adjust X? And just hear, yeah, of course.
Yeah.
Like, life-changing.
Yeah.
Levels of validation, right?
Well, that's good.
Yeah.
It makes me happy to hear, because I know it's not just me, it's my whole staff. They're amazing, you know. Even the front desk staff is great, you know. If you know, just even people walking in the door, as long as they're aware, they know exactly what to do from the get-go. So and to prep the space and everything like that. But I wanted to say, so we're talking about a little bit about things that the patients can kind of help themselves with, and so you kind of mentioned your fidget toy, but I know that there's a slew of other things. Like I've seen weighted blankets, I've seen, you know, and here's the deal: is I was trained for autistic, you know, low functioning children, so this is where my training began. So I have a bunch of that knowledge, but I've been learning there's a lot more that's just out there in the world for neurotypical people that we think are cool. We're like, oh, weighted blanket's so cool, but like it's immensely powerful for somebody who does, you know, have neurodivergency, but specifically on the spectrum of autism. So if you could kind of like let us know if there's anything that would help somebody who may already know that they're struggling with it at a higher level, whether they've sought care successfully or not, like little things, tips and tricks, or products or something that can help them help themselves.
Do you mean in the office or at home?
I'd say at home. At home would be better, you know, because like a lot of our tools aren't really accessible so much. But you did mention earplugs, you know,
Yes.
that's a great one. Or even bring in an eye mask where you go, you know.
Yeah, so I really enjoy loop earplugs because like they have different levels of noise cancellation. Come in this little case. I have one on my wallet. So this has my earplugs in it, and I can put these in and I can still hear conversation around me. I also use I like Apple noise canceling headphones. For me, that's been the best balance because they specifically cancel out certain ranges of sound.
Oh, okay.
So you can still hear conversations again, but you don't get all of the really loud background noise.
And is that the max with the earmuff style, or is that kind of sensory too much?
It just
or
depends what a person
to
prefers.
person? Okay.
Personally, I use the little AirPods.
Okay.
The AirPod Pros specifically. The regular ones don't have noise cancel.
Okay.
Yeah. So I also using those preventatively. So before you're already noticing that stuff is too much, I will put on noise canceling headphones in the morning when I wake up to play, you know, my music as I go around my morning. Really just proactively managing your sensory scape, as I like to call it, you know? Like I right down to my dish soap is a scent that I like, right? Paying attention to those things that we don't always think about that your body is picking up and is going into building that sensory experience, because you can like give yourself more time before you hit an overwhelmed state, right?
So if we're talking about sensory, we're talking about senses, just to review what the senses are.
Yeah.
They are, you know, sight, sound, touch, taste, and what's the other one?
Sight,
Sound, smell,
touch, taste,
smell.
Yeah.
Should have known that.
So like maybe it'll help if I go through like a typical morning for me and what things I use.
That'd be perfect, actually. Yeah.
Awesome. All right, so morning starts. I'll put in my noise canceling headphones and play some music that helps me. Music also is really great for like wrangling your willpower, so to speak, like your motivation for the day. Everybody's brains respond well to music, but neurodivergent people especially find this a powerful tool for harnessing our abilities. So noise canceling headphones, playing some music, starting the day. I have a whole thing with smoothies. We mentioned that eating tends to be difficult, eating healthy tends to be difficult for neurodivergent folks with sensory. So experiment with what textures work for you. But you know, I think we're actually going to put a separate resource on this on the website, so I'm not going to detail it too much. But this is one of those areas where don't try to do things the way you think you should or how other people do it. Figure out something that works for you. So for me, I figured out if I do a batch of smoothies once a week in mason jars, not using anything that makes it go bad in the fridge. There's a specific ingredients that I'm okay with, specific ones I'm not, and that's fine. My smoothie doesn't have to look like other people's smoothies, right? Figure out something that works for you. Then, like, just these hidden ways of getting vegetables is really big. Vegetables tend to have intense textures. They can be hard for us. So I really like Purdue chicken plus nuggets because they're part chicken and part vegetables. Finding things like that, little solutions that work for you. You mentioned sensory things, like, so we're going with touch. Don't try to force yourself to wear clothes that aren't comfortable. I think I look pretty professional today, and this just feels like pajamas. Find something that fits your style and is comfortable. just because somebody else says, oh, you know, you have to put up with it, you really don't. Your home, the way you decorate your home, pay attention to what feels calming to you at home, what colors, what organization methods, what textures are going to feel good as you look at them and touch them going around your day, your scentscape, what scents your soaps are, your ambient scent, I guess. And you mentioned weighted blankets. I think those are great. They're great for autism. They're also great for anyone dealing with anxiety. So these are sort of like background things you can do to prevent and sort of manage as you go your sensory experience. Also sunglasses when you're outside.
Lighting, like having a little bit of like options for light,
Yes.
alterations, I guess, like how you can have like dimmable lights or just lower lights versus bright lights, you know, things like that.
Yes, if you have the option, I highly recommend smart home connections, both for lighting, so you can just, at the spoken word, change what lighting you need. But also for like people with ADHD, being able to add things immediately to their to-do list, set alarms, like turn music on and off, like externalizing that executive function, so great, so helpful. That's also a whole other video.
Yes.
Yeah.
And then
so,
what about, let's talk about these like fidget spinners or
Yeah.
fidget toys.
So fidgets can be anything that you personally like.
Okay.
So during sessions, I crochet. What usually happens, so what happens for a neurodivergent brain is, this is one of those areas where we can actually be really good at things. You know, your brain wants to do a bunch of different things at once. You have this ability to sense so many things. But to prevent that from becoming overwhelming or to take control over the part that you want to be focusing, it's just nice to have my hand doing something. This is taking care of the sensory motor part of my brain so that the verbal part of my brain is free to focus and chat and have this conversation. I could not do a crochet project that required me to count in my head while I talked to a client. I can only do straight lines that are pure sensory motor. So you kind of just have to figure out what you like. I have these little squishy guys. I have a bracelet that's a click-clack thing. It's all about the feedback and the kind of sensory feedback that, for lack of a better word, that does it for you, you know, that gives you that little, ooh, that's nice, right?
You know what might be nice too in the comments, if you guys have any really cool fidgets, like to mention them or anything that you guys would recommend. Why not? You know, get that going. That's not a dangerous recommendation, you know what I mean?
Absolutely.
In my opinion, you know, so.
The dollar section at Target, great.
Or dollar store, I mean, even.
Or dollar store,
You can find anything, you know, as long as it's not toxic.
Yes.
So, but.
Yeah.
But that, I think that's really great to like give people some resources, you know, so, you know, if they, you know, even if you don't know if you're on the spectrum or neurodivergent or anything, you know, what is a $1 toy, picking it up and seeing if that doesn't help you think clear, or a weighted blanket that you can get from Target, you know, if that doesn't make you fall asleep better at night or take that needed nap from being overwhelmed or whatever, you know, so lights, you know, getting a different light bulb that I think they come in a pack of like 2, and you don't even have to get Philips, but it's like these things that connect to your phone, and we all have phones. So those kind of things I think are really great resources. Do you have any other resources or anything that you would want to mention? You mentioned I want to just recap, you mentioned the test.
At Embrace Autism.
EmbraceAutism.org. Okay.
And then, honestly, you're the resource that I refer my clients to for physical issues.
Yeah.
So you're kind of a unique resource in that way. Not every chiropractor works the way you do. I will say, if you don't have access to someone like Dr. Jen, then a chiropractor is great, but self-advocacy needs to be high.
Yeah. And half of this is, you know, for fellow practitioners to kind of, you know, if you start to see this demographic show across, you know, your office front steps, that you might be able to find more resources in order to, or just to easily accommodate, even if it's not really within your scope, to get them through those first couple visits, you know, get them until you can get them to the necessary place that they need to go. But there are actually, and I'll link it below, I'll have to look up the like association where there are allied health professionals for autism spectrum.
You know, one more thing to mention, if you are feeling high levels of anxiety, and you think it's anxiety, but then you're questioning, well, is it autism? A great way to check without a test, but just with yourself, is give yourself low sensory time when you're anxious. That means go to a place that has low lighting, calming sound, soft things or comforting things to touch, or even try, this is what I often do at doctor's appointments. I tell them ahead of time, like, hey, this is a high sensory experience. If I get sensory overwhelmed, you might see me do this. And I'll just breathe and I'll be back with you in about 30 seconds. I'm fine. I'm just giving myself a little sensory break. And if that is calming to you, then what you're experiencing might not just be anxiety, it might be reaction to sensory inputs.
That's a really good tip, because that people have hands and they can take it anywhere, right?
Yeah.
So that's great, and
It's
everyone
the
should
best
have
tools.
patience to give some 30 seconds to like wipe their sensory plate clean a little bit to get back into, you know, the appointment or whatever it is.
That, and if someone is struggling, give them the option to write instead of speak.
That is great. Yeah, absolutely. And that is something, that's a huge accommodation that doctors' offices need to have, since we're going away from paper. Ways that people can either message somehow the office, you know, type, different ways of communication that isn't always verbal is great, because even in those tier 1, what I've noticed, the tier 1 or high functioning autistic patients, they will have their days where they're done. It's done. We're not doing it. We cannot do that right now. But their lives still have to go on. Their schedule is still going on. They still have to show up to the doctor's appointments. So having that ability to message, email, and write, you know, sometimes the writing gets hard with the hypermobility depending on like how severe that is. So different things, just having different forms of that and being aware of it, and not like no alarm. Just we're just not going to use our words today, and that is okay. Like that is one of the most low level forms of communication. So but that's really great. And so we're going to be linking Shira's website up, and a couple other of the resources that she mentioned, so that everybody can have access. I would implore you to reach out if you have any questions, you know, mostly to Shira, and then she usually sends to me, because she has more of the answers, and she's really good at triaging people to where they need to go, but also to hopefully get you the care and the answers that you need, you know, if you do feel like you're struggling with this. And for practitioners, if you have any questions, you can also message me. I will do my best. You know, like I said, my training was traditionally in children with lower functioning, but this is more of a something I've learned through experience, and just tips and tricks. You know, we're not training anybody, but we just wanted to, for Autism Awareness Month, we wanted to put out awareness, and since we do integrate so intimately with each other in our practices, we thought this would really be a good, you know, speaking board for that.
So lucky that we found each other.
I know.
It's done so many great things for so many of my clients.
I know.
And me.
Yeah, I mean, well, I guess, and you guys are awesome. So
I have one last thought I want to include, which is the concept of judgments. Like, whether you're a patient or you're a doctor, it's really important to get away from any sense of this is good, this is bad, I should be able to do this, I shouldn't need that. It is what it is. Things are different for different folks, And when you reach that ability to stop putting yourself in what you expect for someone else and figure out what works for you, it is life-changing. A whole new world of self-compassion and really just opportunity to harness what you're great at. So, doctors and patients both, there's no good or bad anymore.
No.
There's no shoulds or shouldn'ts. There is what is.
Yeah, and that is a very huge concept, you know, that could completely be an entire other discussion, but
Yeah.
but yes, just meeting people where they're at and meeting yourself where you're at, even if that's minute to minute, day to day, person to person, you know, interaction to interaction, sensory to sensory, whatever it is, you know, just be one of the great things about the spectrum is that you are hyper aware. So use that as a superpower to then advocate for yourself and give yourself what you need in that moment. And
Not to downplay the struggle. It is hard,
Yeah.
it has been hard, you know. When nobody's trying to say, to lean into any toxic positivity and say, oh, it's great to be autistic. If you're autistic in a neurotypical world, it's hard.
Yeah, it sucks. So yeah,
And there are strengths.
Yes, exactly. So double-edged sword, of course, but you know, definitely acknowledgement and acceptance, I think, are the two key things for doctors and patients, but also patient to themselves, you know. So, and if you're a caregiver or a family member, definitely both of those for those ones that you're taking care of or your loved ones. That's huge. That's foundation, you know. Should be for everybody, but especially for this demographic. So, but thank you so much, Shira. This is really great. Yeah, obviously we've said it multiple times. We feel really blessed to have found each other, you know, circumstantially, like just being so close to each other, and helping, you know, up here in this Edgewater community. But, you know, you can reach out to us. Our resources will be below because we both do virtual appointments as well and consultations, even if, you know, for me personally, you can't be in the office physically. I can also try to help and find you another practitioner that is in one of those associations that works with on higher level or just the full spectrum of autism as well. So, and then obviously for therapy, Shira is a great resource to either, you know, have clients or to triage that's best for you. So I hope you enjoyed this, and let us know if you have any questions or comments in the boxes below, and if you have any like fidget toys or any other suggestions that might help others.